Mr. Shimkus.
Thank you, Mr. Chairman. It's great to be with you, old freshman next-door neighbor on the fifth floor Canada.
Here early.
We've come a long way, haven't we? I agree with Ms. Moore. I think we're going to go down in history tomorrow, but I'm not sure in the manner that she's hopeful. I got 4 amendments that I want to address, and I'll do those briefly. One is, and I got to send in with the chairman's deliberation, which I found interesting, and there is a philosophical difference about markets and government intervention. So the first amendment just provides an opportunity for people not to be trapped in Medicaid, but would allow them to, through premium assistance, purchase into the individual market. Because it would also keep to the President's promise, supposedly if you like the insurance you have, if they like Medicaid, they can stay in there. But really, a free competitive market with a state exchange, you would want them to have access to that. So we believe in markets. That's what the First Amendment would do. The Second Amendment just talks about the safety net. The promises that have been made is insurance will not go up. Insurance costs will not go up. The first 5, except for Ms. Moore, all served on the Energy and Commerce. We all went through the big brutal markups along with Ms. Matsui. We believe insurance rates will go up. To ensure that that doesn't happen, then we have this amendment which offers a safety net would say that if the individual policies go up, then this is null and void, and we'll go back to the process where people will not have to pay more insurance because of the government policy. The last 2 deal with the federalist system form of government. And I think what we see and we saw out today, and again, ideological debate is, I still believe we have a federal system. I still believe we have a 10th Amendment. I still believe that states have rights identified by the Constitution that are not, the federal government has rights under the Constitution, and if it's not listed in the Constitution, it's the right of the states. So a lot of the people who are protesting are saying, okay, where is this involved in the debate? States are moving on individual pieces of legislation. So the Third Amendment would be in addressing the anti-individual mandate portions of the bill and ensuring that if states decide on their own to opt out from that they'll be allowed to do so. What I find very curious in this whole health care debate is states have a huge part in this debate, and we have just disregarded them. They have the state insurance commissioners. A state like Illinois, I mean, we don't have mandates on the cost. We don't price health insurance. We allow the market to do that, although our state insurance commissioner is highly involved. No state input in that aspect about this, and really no state input in the aspect on this incredible Medicaid expansion. So the Fourth Amendment deals with the Medicaid expansion and the ability for states to opt out if they feel that because of the expansion of Medicaid, it's going to break the bank. And for a state like Illinois, we're a very generous state as far as all the criteria for Medicaid. But this bill still expands more people into Medicaid, which will add $2 billion additional cost to the state of Illinois. And as I said on the floor last night, we're already $11.5 billion in debt. We're as in trouble as California with the state indebtedness. And now the federal government is placing an additional mandate. The federal government is placing an additional mandate with this bill on the states, that the states are making decisions of whether they want to accept that or not. And the Fourth Amendment would say if the states decide through their legislative branch, signed by their chief executive, to opt out of this expansion, they should. I appreciate that. I'm willing to take any questions, and I yield back my time.
All right, thank you very much for your testimony. Are there any questions?
Thank you.
Dr. FOXX.
Scott, I would like to ask Mr. Shimkus if he would about the issue of people being able to keep their insurance and about the price going up. I don't think we really adequately dealt with this with the panel that we had, but I have several pieces of information from CBO on discounting the fact that the president has said, if you like what you want, if you like what you have, you can keep it. And I wondered if you might expand on that a little bit in terms of what you're aware of in that regard, because I have some numbers, and at least 5 million seniors will no longer be able to keep Medicare Advantage. A lot of people in my district are going to be hit with that. HSAs and the high deductible plans. I wonder if you could expand on that a little bit.
And I appreciate that. That's why we'll make history tomorrow, because every individual's policy will change. The president is incorrect that if you have a policy that you like, you will keep it, because they will all fundamentally change. They have to change. We're now imposing new rules, new regulations, new participants, and they will all adjust to the market. So it's just not correct to say you're going to keep the same policy that you had. They will all change.
Thank you.